traumatic or non-traumatic event and is not related to a congenital or degenerative disease, and can result in temporary, prolonged, or permanent impairments in cognitive, emotional, behavioral, or physical functioning.
We take that data and then we send it to for interpretation and measured against
It really hit home that medicine is only partly about tackling the problem, and it needs to be also partly about supporting the body's ability to heal the problem itself.
It's important and often overlooked to submit an initial medical form. So people go to the emergency room and from time to time they'll get diagnosis of concussion, even if it's at the acute stage. And that's often never sent to an adjuster. And usually clients are handed that when they leave the emergency room. So I encourage you to ask clients for that.
So my research has focused around the needs of family members of severe brain injured patients, as well as looking at causes of UTI and the association with how long the catheter is in. And then most recently I've started to focus on geriatric trauma because the shift is going towards that as the population increases.
So we have to really consider what is the long term, what is the big picture for this person. And if we're dealing with it just as a task of, okay, let's get them home or let's make sure they have some equipment, just remember that the community is complicated, and so we really have to pay attention to the subtleties of things because the long-term impact can be much better.
The dream team is built on a foundation of shared meaning. Whether we're sharing meaningful activities and passions, or we're sharing meaningful values, beliefs, mindsets, or we're sharing meaningful connections to the same things. We're connecting on a meaningful level.
We can be part of this great wellness revolution and help transform lives with the patients that we see on a day-to-day basis, but we don't have to become casualties ourselves. There's a better way.